So, part of this is a sterile procedure. Most of this is a clean procedure. So you'll just be wearing your regular blue gloves, but you will need to put a sterile procedure on the door and shut the door. Okay? Part of your supplies is gathering your mask. When you get to the sterile part, the patient will need to wear a mask. You'll put that on right there. And then you'll need to wear a mask. For the purposes of this demonstration, just pretend I have a mask on. Okay? We'll set that right there. So, you've turned your cycler on. It says press go to start. The next thing you're going to do is your hand hygiene. And then you've gathered your bags. You want to make sure you have the right solution. Baxter has them color-coded. We'll just open this first bag. It tears down. They come in 5 and 6 liter bags for use on the cycler, depending on how much your therapy volume is. And again, we'll talk about that later on in the procedure. But you have your 5 liter bag. Yellow is a 1.5%, green is a 2.5% solution, dextrose, and red is the 4.25% dextrose. That's part of your prescription. So the doctors will order that on a daily or as needed basis. You've got your first bag on the heater. You want to make sure that it covers the silver dot that's on the heater. Okay. And then these cabinets are great to use with the cycler because then you can open up this drawer, and in the top drawer you can place your other 2 bags. For this demonstration, we're going to use the 3-prong bag. If you have 4 bags that you need to use based on your prescription, you can use the 4-prong and still be able to lay one of the bags potentially on the heater like so. Or you could lay it in the drawer across the top as well. So you have options. Okay. So now that you've got your bags ready, you're going to get, this is your 4-prong cassette. We're going to put this one to the side, and we're going to use our 3-prong cassette. So all we have to do is take it out of the wrapper. And following the directions, we're going to press go because we want to start. And it's going to tell us to load the set. So we lift up the door, let it come down, and there's only one way to load the cassette, and it's the right way. It won't fit into the cycler in any other way. It just pops in. Like so. And then you lift the door back up, close the latch, and make sure it's secure. Then you take your cassette holder and the slot that's right there, and then snaps into place like so. And you can take your tape off here. And once you're done loading the set, you finish that. You want to go forward to the next step. You're going to hit go. it'll tell you to please wait. The cycler will do some internal checks, and then you can get ready for your next step. You're going to go from right to left in setting up the cycler. This is your drain option. And so you'll take this off. And they call it the drain option because you have a couple of options as to what to do with the end of this drain line. You've got a pretty good amount of cord of drain line. So some patients take this and connect it directly to the toilet, so it drains directly into the toilet. You have a drain line extension, a drain line extension that you can connect to the drain line if you need more line that goes and drains the effluent directly into the toilet. But most of the time, the physicians and the people here prefer you to use your drain bag. They come two to a bag. Get it open. There's usually a little slit somewhere. So you pull out your drain bag, and you'll only need one, so you can put one to the side for the next day. You have a spike, and then you have your outlet. You want to make sure you clamp your outlet, because when you put this on the floor and it starts to fill up with fluid, it'll leak through if it's not clamped. Okay? So then you have your spike. You're going to take your drain option, remove your tape, clamp your sample line port, take your cap off, your spike, and make your connection. Just to double check, you have your outlet clamped, your spike is open and connected to your drain option, and then closer to the top here, you have your effluent sample line clamped. And I'll bring this back up later on in our procedure. We'll talk about this. Okay? So the next thing you're going to do, and at this point, you'll have your mask on, your patient's mask is on. You're going to take your heater bag. These are color-coded for a purpose. So the first one is your heater line, and it's color-coded red. So you take your red line, you're going to pull your cap, pull your yellow cap, let it drop, and then make your connection and screw the two pieces together. And then break your frangible. You're done with that one. You're going to take your white line to your fill bag, pull the cap off, keeping them in your fist with your thumbs and your fingers behind the sterile parts. Pull the protective cap off. You can drop those two pieces and screw the two together until you can't see any part of the white above the lip. and then break your frangible to where you can see daylight in between the two pieces of plastic inside. Okay. And then the last one is color-coded blue. This is color-coded blue in case your last bag fill is a different dextrose. When we talk about programming your machine, which we will here in a few minutes, then if the doctor writes a prescription that the last fill is going to be a different dextrose concentration than what you use for the whole therapy, the blue line becomes very important because it'll go to the last volume, the different dextrose from the other two bags. Okay, so again, you're going to pull the cap off, pull the protective cap off, screw the two pieces together, and break your frangibles. Okay. In the meantime, it's been saying connect bags, open the clamps. We just did that. We connected the bags. All of our clamps are open, and you know they're open because you can slide them. This last one, at this tall one, is the patient line. This is the part that you're going to be connecting to the patient's transfer set. You want to leave the cap on and leave the line unclamped because when we go forward to the next step, after we press go, it's going to prime all the air out of the system, and so it'll prime this long line. So we want to go forward to the next step. We're going to press go, and the priming process takes 9 minutes. So in that 9 minutes is a great opportunity to make sure that you have a recent set of vital signs. The patient's daily weight is entered into the CCPD or entered into EPIC. This is also a great time in the 9 minutes that if you're going to do your exit site care, you could go ahead and perform your exit site care. So the machine just beeped. It'll make one fairly loud beep just one time. And then the next thing you'll see is check patient line, connect yourself.